So this is a apparatus called elevated plus maze. So it is used to study anxiety and anxio anxiolytic, or you can say anxiety and anxiogenic uh, activities in mice. Okay, so this is designed for mice. To describe this apparatus, it is elevated at 30 centimeters from the ground. It has 4 arms, as you can see. 2 arms are closed arms. They have side walls from 3 sides, and 2 arms are called open arms. You can see these 2 arms are open arms, these 2 arms are closed arms. So what we do is, there is a central platform which is around 5 into 5 centimeters square area, where we will place the animal, the mice, and we will observe the mice for 5 minutes. So there are two or more than two criteria or parameters which we can get from this uh, elevated plus maze. One is the animal. These rodents, they have natural tendency or fear for heights. So because it is elevated at certain level from the ground, and they have fear to heights, they will try to spend more time in dark arms, either this dark arm or this dark arm, and they will spend less time in open arms due to fear of falling. Okay, so we can have the time spent in open arm and time spent in closed arm as parameter, as a finding, as an observation. And also, this is due to anxiety, that means fear. If the animal is fearless, because if you can test some drugs which decrease fear, which decrease anxiety, so in such cases these animals will be showing more explorative behavior. That means you will know this by observing certain behaviors, like head dips. When the animal is in on the open arm, it will peep, or it will try to look on the bottom, so to explore. So it's called head dips. Head dips. Okay, dipping the head to look what is there below. And also vertical rearings. The animal will try to stand on its hind limbs and explore the apparatus. Okay, you will see this around the central area. So these are the parameters, some of the parameters which we can use to study anxiolytic drugs or anxiogenic drugs. Okay, now I will show you how to place the animal in the central platform. Okay, gently, and the time starts. The test time for this particular experiment is 5 minutes. So as you have seen, the animal has fallen down. So this will negate the test. So what we should do is, we have to pick the animal and again place it to continue the test. So as you can see, the animal it looks uh, less anxious, so it is exploring. It is it's showing head dips. See, it is showing head dips, and initially it went into the one of the closed arm. So this time through this video recording, or we can calculate the time it has spent, how much time it has spent in closed arms and how much time it has spent in open arms for in the period of 5 minutes. So as you can see, in the beginning it it was in the open arm and trying to explore, okay, and even it fell down. So uh, till now it seems normally any control mice or normal mice will spend more time in closed arms because of the fear, okay, fear, and this fear will lead to anxiety. So fear due to any harm or danger will lead to anxiety. So as you can see, slowly it is trying to explore the open arm. You can see some head dips. This is vertical rearing, you can say, standing on hind limbs and exploring the apparatus. So if you see more of this behavior when you compare two groups, one control and the other test group which has been given any test drug, if you see more head dips and vertical rearings and more time spent in open arms, then you can say that particular test drug has anti-anxiety properties. So for example, diazepam, a barbiturate, a benzodiazepine drug, it shows such properties, that is anti-anxiety properties. When you give the mice diazepam and you study the mice using this elevated plasmas, it will clearly show anti-anxiety properties. That is, by you will see it is spending more time in open arms, you will see more head dips compared to the control group, and also vertical rearings.